What are EMFs and how do they relate to our hormones? That's what we're talking about. Some other things that can come in externally through our environment, how they can wreck our hormones, and how we can lower our risk for that. Remember to like, subscribe, and share this video out if you or someone you know wants to get off the hormone roller coaster. I'm Dr. Shelley Meyer. I'm a functional medicine doctor, family doctor, and registered dietitian, and I help my patients and my YouTube viewers try to get off the hormone roller coaster. So today we're talking about another thing externally that can come in from our environment and affect our hormones, and that's called EMFs. So what is an EMF, if I can say it? Electromagnetic waves or electromagnetic fields. So they're both ionizing and non-ionizing, and we're also going to talk about the different types, the different levels, and where they're coming from, and what we can do to lower them so that we can preserve and help our health in general, reduce free radicals, reduce damage to our DNA, but also help our hormones. So we're going to talk about the different categories. ELF is extra low frequency. That's less than 300 hertz. That's only in usually military equipment and railroads. So we do have some exposure to that. So the second category is IF, intermediate frequency. That's between 300 hertz and 10 megahertz. And that can be in industrial cables, can be in some of the electrics in our house, it can be in our TVs and in our computers. And then we go to high frequency, so that's 10 megahertz to 3,000 gigahertz. So giga, our internet, is our Wi-Fi, our mobile phones, our radio kind of broadcasting, those are all in that category. So you see we're exposed to these a lot. As early as 1979, they did some research and found that EMFs could lead to infant leukemia, which goes close to my heart. I have a daughter who had leukemia, and luckily she's in remission, but I did some research into that, and it's just kind of alarming, very alarming, that these things that we're exposed to could contribute. Granted, we can't really trace that. We don't really know exactly, especially in a child, but they did this study with infants and they did find a link. They also can, like I said in the beginning, can damage our DNA, contribute to brain tumors. They did a study in rabbits and they found that when they were exposed, it increased their blood pressure, increased the chance of a heart rate abnormality. So we do have to think about the additive effects. So anyway, in this study, in the 2.4 gigahertz exposure, I think it was several hours a day, 5 days a week, to the rats, they did find lowered sperm function. So it is affecting and lowered testosterone. They also, in other separate studies with similar exposures in female mice or rats, found that it could lengthen the cycle, the menstrual cycle. So it screws up our hormones that way. Could decrease the follicle count. So less follicles means less fertility. Also increase our oxidative stress, meaning releasing more free radicals, and then we have that DNA or gene damage. Also, they found in other studies that exposure to the gigahertz, the Wi-Fi, the mobile phones, decreased melatonin, which, as we know, I've talked about, contributes to our circadian rhythm, our ability to sleep. Also, though, affects our sex hormones. Melatonin does relate to our sex hormones, and in my next video I am going to focus on that. So, do you know anything about EMFs? Have you learned anything? Have you tried anything to lower your EMFs? Comment on any of the above down below what you think your exposure to EMFs are. So, what are some ways we can lower our exposure? So, one obvious one is to not put your laptop on your lap. I know it's called a laptop, but we don't want to put it on our lap because of that exposure. You know how hot it gets. You're getting a lot more exposure when you're putting it next to kind of your reproductive organs. You can use a laptop shield. There are several companies that make laptop shields. There are EMF blocking cell phone cases you can use as well. You can turn off your Wi-Fi, and you can turn off your Bluetooth as much as possible, or you could just go onto airplane mode, which is even better. I use a device from Aris Tech, and I can't show you, it's on the back of my phone right now. It's a little EMF blocker. It comes out of a little pocket, and you can put it into your bag, keep it next to your computer. I really like that one. There's a lot of different companies that make them, but I do have an affiliate link down below where you can get 15% off now for the Eris Tech one. But like I said, there's lots of options to look at, and I'll link some of the options down below. Another way that you can reduce your exposure is to actually ground, to take your shoes off, to go barefoot, not in the snow in Colorado right now, but maybe if you can tolerate it, but to go barefoot outside for at least 30 minutes a day, either touching the ground or touching some kind of ground surface. That is called grounding, and that's really good for connecting with the Earth's energy, neutralizing our exposures. So think about the EMFs in your life. Think about trying different ways to lower your EMF exposure. There are some ways that you can set timers to turn off, like I said, your Wi-Fi, but you can turn it off all night. If for some reason, if your lifestyle allows you to do that, everybody has different needs. And use that airplane mode as much as possible, but really think about how these are affecting your hormones and affecting your cells and your DNA. So leave a comment down below if you have any questions, if you have any tips about that as well. If you're really into learning about getting off the hormone roller coaster and want to learn more and want to be part of a supportive private network, you can check out the invite down below for my Mighty Network. We have, I conduct monthly live Zoom sessions on there with Q&As. We have tons of recipes and tips and tricks and different monthly topics that we talk about for hormone balance. This past month was hormonal weight gain. We've talked about sleep problems with your hormones. We've talked about anxiety and mood issues, and all kinds of things that just help support our hormone balance. So recipes, ideas, and also when you join that network, you have access to my 8-week course, my Emerge course, for any woman in their late 30s to early 50s. And so this group is for women, and it's anywhere from late 30s to early 50s. This course is devoted to, and it has tons of ways for you to balance your hormones, all direct information from me, gained from my functional medicine practice and my experience working with women to get them off the hormone roller coaster. So we deal with estrogen dominance and progesterone deficiency and all the pertinent topics to hormone balance, so you get access to that. And remember, if you want to check out the Eris Tech device, I have some links down below. I'll have some other links of some things you can check out to lower your EMF exposure. So thanks for joining me. I'll see you next Friday when we talk about getting off the hormone roller coaster.